I'm Dr. Greg Hopkins, and I have with me the trial frame refraction paddles, and I want to show you how you can use them to very efficiently perform a trial frame refraction. In the right hand, I will hold the concave or plus lenses, which you can confirm are in focus at near like this by looking through them. The minus lenses here will diverge the light, so it will be difficult to accommodate through them. With these, you can check to see whether the patient is leaning towards nearsighted or towards farsighted. And the way that you do that is by showing them a lens large enough that they can respond to it. So a +4 lens, hopefully our patient will be able to tell that that's blurry when they look into the distance. We will combine that with the -4 lens over the right eye. And then I'll show the -4 lens by itself, and then I'll stack them again to show the Plano option. If I'm working with the right eye, I'm going to turn it like this so that this column is able to be slid up and down over the right eye. If I work with the left eye, I'll spin it this way so that the columns go up and down like this. And then what I'll usually do is make sure that these lenses cancel out. So if I show +4 here, compared to Plano, hopefully the patient will respond to Plano is clear.
Plano's clear.
And I can move this away, and then I can show the -4 and then come back to Plano again. So hopefully that's a pretty obvious sort of softball question. The way I like to get into the routine is to call this plus lens option 1, the minus lens option 3, two lenses sandwiched together, cancel out, and that's option 2. Any of those of us that do refractions know that 2 is usually the right answer. So this is 1, and there is 2.
2.
And hopefully, as you go along, there's 3 and 2.
2.
The patient will continue to say 2. There's 1, and there's 2. But you never know.
This one.
Okay, you like that one right there?
Mm-hmm.
Okay, so you can make your adjustments based upon that. When you're done with the refraction for the right eye, you can spin the paddles around, and then I usually will keep the hand that's checking that eye vertical, and then the other hand I usually like to go diagonal to overlap them so as to not get in the patient's nose or mouth. But this will go up and down here, and then these will go at a 45 degree as we overlap the lenses to cancel them out. I'm Greg Hopkins. This is a trial frame refraction bar for low vision patients, but also it's very helpful for interpreting exams, any patient where you need to show large lens changes. What I've done is I have lenses in a series from an 1/8 of a diopter all the way up to 16 diopters. So this essentially covers your entire trial frame kit, from the lowest powered lens that a person could conceivably be able to tell the difference between to a 16 diopter lens, which hopefully our patients will be able to tell apart when we show them. And the cutouts that are on here are the same size as the holes in the phoropter. In this column here, I have lenses from a 1/2 diopter up to 4 diopters, doubling with every lens, so a 1/2, 1, 2, and 4. And this is the range where I think most patients from 2400 to 2050 would be able to easily respond. And so, for example, if I wanted to start with the easiest lens to tell a difference between, I would show this +4 lens here, and then I would stack the -4 lens on top of it to create the Plano option. And I would take away this lens to show the -4 and then restack to show the +4. So the way that it would go is, and I'll show this to my patient, is this better 1 for you or 2? Again, that's
2.
1, and you think 2 is better?
Yes.
And then here is 3, and that is 2 again.
2.
And so then I can just keep going down the bar, making the lenses harder and harder to tell apart. That's 1, and there's 2.
1.
And then if the patient selects lens 1, we dial that into the machine. The lenses line up with the whole of the phoropter if you center it over the knob for the astigmatism. And then when it's time to check astigmatism, if you need, you can then switch to your handheld flip cross to check astigmatism, axis, and then power.